What about an epidural? One of the things they want you to look for is a drop in the blood pressure, the hypertension, because then that will affect the baby getting the oxygen, okay? Now you look underneath the vessels, you've got the uterus, the placenta, the cord, and fetus. Look at how many steps are involved to get oxygen to that baby. So you see your baby, you really want to be able to monitor if that baby's getting oxygen. Because if that baby doesn't get oxygen, the hypoxemia develops. But that isn't the major problem. The major problem is when it's metabolic acidosis. That's where you have the potential for injury to the fetus. That's where you see cases of CP, learning disabilities. Later on, you might see it a few years down the road. In fact, labor and delivery nursing is probably one of the most highly litigated areas of healthcare because of that. And actually, you can have a range of many years where you could have a lawsuit because you might see learning disabilities as a child grows up. So that you want to prevent is the metabolic acidosis. So if you have someone coming in and you do the monitor tracing on them and you see a deceleration, you can know for certain that there's probably something going on there. And it might be normal and it might be okay. Most of the time the fetus does fine with those little episodes of cord compression. Most of the time they readjust, they don't develop metabolic acidosis. But there are times that it can be harming the baby. Now, the first part of it, if you notice on the top right here, I wrote something down about variable late or prolonged deceleration signal. There's an interruption of oxygen transfer at one or more points on the pathway. There's a problem somewhere, so you do have to know what the problem is, okay? And you need to assess it. Something's getting squeezed somewhere, and you got to know where that is. So you really have to be on top of it. And one thing about it, if you ever do become labor and delivery nurses, is you do go through quite an orientation period to interpret monitor tracings, because that's really important to know how to do that. Now, you might wonder, well, how do I know if my baby's getting acidemic? You know, how do I know that this baby might potentially be injured by this labor process? One thing about your beat-to-beat variability and your accelerations, they kind of tell you that that doesn't exist at this point, that your baby's not acidotic. So that is a good cue that if you do have some decels, but you're still maintaining that beat-to-beat variability in the accelerations, your baby's probably doing okay, all right? But I always say, if you've got any decels that you ever have any questions of, you should get another opinion and get someone to look at that monitor tracing with you. And as students, obviously, you'd be working with a nurse anyway, with a labor patient. Okay, let's go to the next page. There's 3 categories to the fetal heart rate tracings. And the first category is a pretty normal routine tracing. You've got your accelerations, you've got your beat-to-beat variability, baseline rate normal, and that doesn't require any extra intervention other than what your hospital recommends when these women come in labor, okay? Just do your routine monitoring that they would say, or what the healthcare provider orders. Category 2 tracings are not Category 1 or Category 3. They're kind of in between. They're kind of the ones that you've got to interpret and question and do some surveillance on. Let me just go on to the Category 3 one. The Category 3 ones really are telling you something's wrong. You got the absent baseline variability. You might have bradycardia. Y'all remember what the bradycardia is? It's below 110, exactly. Yeah. And then the recurrent late decelerations. So if you have that, you've got a Category 3 tracing, and you really need to notify the healthcare provider and decide what you're going to do. I wanted to show you, actually I missed it on this past page. At the bottom, did you notice this tracing I had there? Mm-hmm. What do you think about that tracing when you look at it?
Strong contractions, but further away from each other.
Late decels. There's no variability. Would this concern you?
Yes.
Very much so. This would be very concerning. and you'd want to have some kind of intervention for that baby. Now this pattern is kind of a different pattern. This is what's called a sinusoidal pattern. It's pretty rare, but this is a very not good pattern to have for your baby. This is probably one of the worst patterns. And it's kind of strange. You see no variability, but the line is just kind of a squiggly line all the way through. So they would probably want to deliver that baby.
What does that mean? What's happening?
What's happening is probably your baby is acidotic at that point.
Is it asphyxia?
The hypoxia has gotten extreme and the baby's not tolerating it. Yeah, usually that's what that means. So anyways, what kind of interventions are there? Let's go back to the previous page and look at our thing again between the environment and the fetus. Oxygen.
Position
Turned
change.
up. Okay.
Take them off pit.
Take them off pit. If your uterus is squeezing, that's definitely one thing that's going to affect the cord. There'll be cord compression. It might affect the placenta. So you do want to stop that Pitocin. What else besides the oxygen?
Turn them on their left side.
Okay. Turn them on their left side. Try a position change. Sometimes the umbilical cord, I've seen this happen where the cord prolapses into the birth canal.
You have to push the baby in.
Yes, you do a vaginal exam, you have to push the baby's head up to relieve the compression.
I forgot the name of the position, but
Trendelenburg, reverse Trendelenburg, is that one? So, and you probably deliver that baby very quickly. Yeah. So, what other things can you think of besides stopping labor, if you can? If, let's say, you're doing an induction, position change, maternal oxygen,
fluids.
IV bolus. Yeah. And in fact, before an epidural, a lot of times they will give them an IV bolus to increase their volume.
Is it 1,000? Is it a whole liter?
At this hospital, is it a full 1,000 or is it 500? I think it's 1,000. Yeah. So that's a really important thing, is to make sure that you know what you need to do in a situation like that. And hopefully, I know, how many clinicals y'all got left? 2. Maybe you'll get to see a baby being born and look at some monitor tracings. Maybe when we're up there, they have the screens up of all the people in labor. Maybe we can look at those together. Yeah, and try to see what's going on. Do y'all have any questions about any of this? Does it seem pretty clear? Alrighty. Thank you.
Thank you.